Thank you, Mr. Chairman. Thank you for holding this hearing, and thank you, Ranking Member. So military families keep us safe, and DOD's TRICARE program is supposed to keep those military families healthy. Since 2009, the TRICARE pharmacy benefit has been administered by Express Scripts, the nation's largest pharmacy benefit manager, or PBM. Express Scripts decides which pharmacies are in-network or out. So when one of those 9 million military families needs to pick up a prescription, Express Scripts decides where they can go to have it filled, and then they pay the pharmacy. Now, Express Scripts is owned by the multi-billion-dollar health insurance company Cigna, and Cigna also owns a mail-order pharmacy called Accredo that participates in TRICARE. In other words, Cigna owns the company that pays the pharmacies, and it also owns the pharmacy chain that is getting paid. The result? Well, Express Scripts can under-reimburse the other pharmacies and give inflated payments to its corporate cousin, Accredo. Express Scripts has been caught doing exactly that kind of self-dealing in other government programs, but right now the Department of Defense refuses to check how much it is costing taxpayers in TRICARE. Mr. Cuban, you understand this business, so let me ask you, would requiring Express Scripts to disclose the difference between what it pays its affiliated pharmacies and the unaffiliated pharmacies help save taxpayers' money or cost taxpayers' money?
It would save a lot of money, and it would keep smaller independent pharmacies in business.
Okay, that makes sense to me. It seems pretty common sense here. More transparency would save taxpayer money. But the Congressional Budget Office disagrees with you and me on this. According to the CBO, price transparency would cost taxpayers money because other pharmacies would allegedly band together to demand higher reimbursements. That's their argument here. Mr. Cuban, you talk with pharmacists a lot. Do you think that independent pharmacists don't know that Accredo right now is getting a sweetheart deal and that the independents are just waiting for information to be told so that they could demand more money?
I can't speak for all the independents, but I can speak for costplusdrugs.com. And so I went to TRICARE, and I have done this in the past many times, and looked up the price of some common low-cost drugs. So just recently I looked up Tadalafil, right? And our price is lower, whether it's 30 or 90 pills, than the TRICARE price is for anybody who is in network but off base. And if they're out of network, we're dramatically lower. So we don't need to band together to know that we can be cheaper. All we have to do is look at some of their prices, and it's obvious that we're cheaper.
Okay, so this information is actually already out there.
Yeah, I mean, it's just by looking at, and I'm just talking about the copays.
Yeah.
We're not even talking about what the taxpayers still have to pay to Express Scripts, Accredo, right? Which is more. They're not doing this for nothing. And so, I mean, taxpayers are getting ripped off, period, end of story.
Okay, and this is where I want to see more transparency.
Correct.
You think that's a good thing?
That's a great thing.
Okay, that's a great thing. Good, I'll settle for that answer. All right, so DOD claims that this hasn't affected military families, but that is based on data from, this has not affected military families, based on data from, you guessed it, Express Scripts. So when the Government Accountability Office reviewed just a little slice of this data, they discovered, quote, persistent inaccuracies, including misreporting the number of people who lost access to their local pharmacies because the pharmacies were pushed out of the TRICARE network. They left for the very reasons you described. But that was just a one-time review. So I'm pushing DOD to audit this information every single year. Dr. Lambrew, you served as commissioner of the Maine Department of Health and Human Services, so you understand the importance of program integrity. Do you think that auditing this program would help save taxpayers money or cost taxpayers money?
Senator, it would save money.
It would save money. So, I just want to point out here, Mr. Chairman, self-dealing by the pharmacy benefit managers keeps the cost of prescription drugs high, both for the taxpayers and for consumers. I'm going to keep pressing CBO to update their analysis of the PBMs, and I hope to work with all of my colleagues to pass proposals to rein in self-dealing by the PBMs in TRICARE and beyond, including my bill with Senator Hawley that would make the same company, say that the same company cannot own a PBM and an insurance company and pharmacy at the same time. Look, we need to stop these giant corporations from ripping off American taxpayers and get a little more competition in the drug market. Thank you, Mr. Chairman.